some of that engagement or individual action. And unfortunately, what quickly became true was a lot of the impediments that people were facing in their daily lives, a lot of the health concerns that they had were not of their own making and were much bigger than things that could be solved through, apps. Basically, the iPhone came out in 2007. The first wave of health apps came out in 2009 or 2009, and it was not the big change that people thought it was, and in part that was because in many ways the problem was way beyond the capacity of any given app to change, right? So putting apps in people's hands was not going to change the fundamental structures and systems, and that was disappointing. It was a real kind of failure of technology to change some of these structures. A lot of them have to do with healthcare. I won't get into that, but it kind of underscored for me that the problems were much bigger than any one person might be able to deal with. And just to use some statistics, the trends were then and have been obvious. More Americans, and these are just two stats of many that I could use, but obviously rising obesity rates and rising rates of diabetes. These represent, I think, large systemic structural problems that we have in our society. It's Public Health 101. But the question is, is there an opportunity to engage the corporate sector in tackling some of these problems, and some of these problems that are often or manifest because of the corporate sector? If you wonder why these things are happening, it's basically they come down to health behaviors. I learned a lot while I was here from Len Syme, who was a kind of pioneer of helping people understand their social contexts. And we were really putting people in the context of eating more, doing less, sleeping less, all these things that people seem to want to do, but ultimately had the result of making poor health for individuals and collectively. And ultimately, so what I came away with and this was about 2016, 2017, was this idea that it's just really hard to be healthy in everyday life these days. And it's because of everyday life. So, and this is what anybody in this room or on the call will know, these conditions are all manifestations of modern life. And they all have behavior at their root. And ultimately it became this question then of this notion of, again, thinking about the apps. Why do we expect individuals to be able to fix these problems when they're actually much larger systems? And it's just not fair. Again, as people in this room will know, healthcare is not the answer. We spend $4 trillion trying to mop up these problems, but more healthcare will not solve the reason they're happening. In fact, if you look at traditionally where society chooses to engage with this problem, we kind of have three levers that we've used traditionally. There's healthcare, there's these lifestyle changes, which as I've said, have only limited impact. And then there's policy, which especially today is under attack and is suspect as possible vectors. So maybe we should go to where it happens. Maybe we should go to the corporate world where the products that people are using are the ones that are manifesting the poor health. So I started this nonprofit about 5 years ago called Building H. My co-founder was the CTO of the Robert Wood Johnson Foundation, and we really just had this realization at first that everyday life was making us unhealthy, and it was a very kind of sad realization, because it's, when you think about how large and daunting it is to try to think about counter programming or changing the course of civilization, it's a daunting, impossible problem, or potentially. So like, how do we actually engage with this? Well, we thought we would break down the problem, and eventually we came up with this idea of, can we actually get companies to change? So we, yeah, this is I don't know if you guys remember the ship that was stuck in the canal, but this is one of the memes that we kind of realized worked perfectly for thinking about what we're trying to do. Okay, so everyone here knows about the social determinants of health. So over the last few years, there's been this new area of study in academically and in research called the commercial determinants of health. The Lancet has really been on the forefront of documenting and publishing on this. But if you look at the PubMed, it's really spiked over the last 2 or 3 years, from almost no papers discussing commercial determinants of health now to 100 or so papers a year dealing with this. So it's still growing, but it's rising quickly. And for me, it's quite heartening that this thing that we were kind of getting onto is we're kind of walking in step with this rising body of research and understanding about how to engage with these commercial determinants of health. But one of the things I wanted to get at vis-a-vis research and the kind of academic framing is my observation has been a lot of the research to date has been very oppositional towards these commercial determinants of health, doing basically kind of a scolding of the academic research community on the corporate world, which is not a surprise, but it's not, I worry that it's not creating a dialogue or a actual possibility for change. And what I've been trying to do is really think about how can we change these systems and structures. And so that's a harder problem, but one that I think we have some promise on. But first, again, we're still in the problem space. It's important to recognize how genius these companies are and these designers are at creating products that are meant to maximize consumption. I spent the last 10 years in technology and digital technology, and they are really good at understanding how to, and I'll give some examples, but how to build products that people want to use, even at their own detriment, even to their own detriment. And so it's really important to understand the kind of opponent, if you will, and understand it in a very granular way. So I'm just going to give some examples, 3 industries. First is they are creating what I would call hyper palatable foods. This is just an example from a chart from a story on a food industry publication on using AI to design new foods, and they are off to the races on this. They are finding ways to create foods that are, again, irresistible and taste so good and make us consume more and more and more. And what I think is important to realize is like AI is being used in many ways to make us do things that make us consume in ways that we are just not prepared for. So the food industry is off to the races. Transportation, I don't have to tell you that the way we use cars in society today is generally not healthy. But just wanted to look at this chart of the best-selling cars last year in the United States. 4 of the top 10 are pickup trucks, which people don't need in that volume. But they're not pickup trucks of old, which is just one front row of seats, right? These are double cab. These are living rooms on wheels. They have 20, 25 cup holders. It's insanely comfortable. And with autonomous driving, they are actually becoming more and more designed the way people design hotel rooms. So that's another unhealthy trend. Okay, and then just looking at entertainment. So I am willing to argue and make the argument, will take more time than we have here today, but that largely our free will, what we perceive as free will and what these companies bank on, and individual consumerism, individual rights, individual choice, that is oftentimes a fiction when we're actually using these products. So when you think about Netflix, this auto play button that gives you 5 seconds to push no. They know exactly what they're doing when they time that to 5 seconds, because most people actually can't respond within 5 seconds. There was a wonderful study out of University of Chicago School of Computer Science, where they looked at the way that that autoplay feature makes people consume about 20% more Netflix. Now, it's not just that button, though. The shows themselves are written and designed to end on cliffhangers. And the cliffhangers are, and if you actually look at I spent maybe half an hour watching the ends of the episodes. This is The Perfect Couple, which is a show with Nicole Kidman on Netflix now. And the cadence of these shows is structured so that you don't want to push that button. So you just want to roll on. And that is just one example of how these shows are being written and designed and produced to make us watch more. There are other ways. The paper is really worth a read. Okay, so ultimately, it's not a fair fight, right? So this problem, this is an example of all these problems coming together. So this is food, right? So it's food that is engineered for us, but it's also done with marketing arrangements with cartoons and pop music artists. And it's importantly in a drive-through, right? So McDonald's is optimizing drive-throughs now, where it's 4-lane drive-throughs. That's their new kind of restaurant. It is, again, they're engineering, they're way off to the races on this stuff. And all these things create not just bad food habits, but social isolation, lack of physical movement, less sleep. It is a compounding of negative health behaviors, all through something that we love, which is drive-throughs. Okay, so that's the problem, which I hope everybody feels is daunting and almost unwinnable. But there are ways we can fight back. And what I want to point us to is, again, this idea that I learned here, Economics 101, which is you look at the externalities. Externalities is everybody probably knows, but it's a very basic economics concept where a lot of products don't have the total social cost factored into the price of the good. And so society ends up bearing the cost of that good. That's closely related to something called market failure. There are externalities everywhere in healthcare. This $4 trillion healthcare system is basically the $4 trillion we spend as a society to mop up the problems, the externalities that are not otherwise accounted for in the price of our goods. But we have had some success as a society clawing some of those costs back. Specifically cigarettes, which is the most prominent example in public health, but also air, water, and food safety, and traffic fatalities. So those have all been kind of health-centric ways of holding companies accountable for the externalities, the costs, the consequences of their goods. I want to be fairly quick here, but the point is that all of these take multifactorial, multi-pronged approaches. It is not just one avenue of attack. First, and most significantly, there needs to be a body of research and science that happens to establish the harm and to quantify what the impact is. With tobacco, it started in the 40s with Dole, but that took 15, almost 20 years before it rolled into the first Surgeon General's report in 1964. So that was the beginning of a regulatory framework that took decades to move the needle because the industry was fighting tooth and nail the whole way. And it wasn't until the early 70s when we had the first laws for clean air, indoor clean air in Minnesota, my home state, proud to say, but that created this system or a structure of social, it starting to make it uncool to smoke. And that took decades. And it was a very important part of waging the war against tobacco because it wasn't until it was uncool, it was the coolest thing you could do. Ultimately that changed. So it was 70 years of work right there. And it's still, it's important to say these are all fights that we are still waging. Carbon and emissions, similarly, it took research. It took a development of alternative technologies. So there needed to be another way for society to go through clean energy sources. It took then regulatory frameworks, and then it took the engagement of a consumer sector. Again, decades of work. The last one I wanted to point to was overfishing, which is a tragedy of the commons scenario. But again, we had to understand the impact on fish populations. That only started to become something that we understood, or that the science started to measure in the 1950s. It took years to establish regulatory framework. And then finally, only into the 90s was there actual structures for penalties for countries that would and individuals that would fish out of season and beyond their catch. So again, a lot of work to turn the tide. But if you break this down, there's a kind of four-step process in kind of clawing back externalities. There's a quantification phase, and there's then the policy phase. There's importantly a phase of industrial and innovation, where there are alternative technologies, alternatives for progress. Because in all these cases, we want the thing. We want fish. We want the energy supply. We want the food. These are things that consumers and capitalism demands. And so we need to find, if we're going to try to put caps or restrictions on them, we probably need to find other ways to supply and to satisfy that demand. And ultimately that goes to the consumer sector as well. So it's good to come up with alternatives. Okay, so that's what I would summarize as a kind of process for engaging commercial actors. Traditionally in health, we've gone after bad actors in terms of externalities. So there's junk food, tobacco, as we've mentioned, alcohol, fossil fuels. Gambling and firearms are more recent kind of targets. And then generally, I would say marketing and advertising industries as creating norms or creating standards of acceptance for a lot of these industries where maybe society would not have a tolerance otherwise. So that's generally when people think about the commercial determinants of health, they kind of, these are the industries of the easy targets. But what I wanted to go back to was, what about the industries that create the structures where most of us live? It's the food delivery systems we use. It's the places we live. It's the Ubers and the Waymos that we take. It's the games we play. It's the things we do. It's the Netflix we watch. That's, I think, where we actually might be trying to focus on maybe should focus on the problem. Okay. Last section is how do we change this? How do we actually start to use these precedents to go after some of these more ambiguous, not as easily scapegoated or demonized industries? For instance, what's the matter with Netflix? Well, let's think about a way to measure that. So the question I would ask is, can we build on these precedents to begin to measure those externalities and their impact on human health? Can we break down the problem and start to measure it, basically? I think there are four concerns or four challenges we have to overcome. The first is just, what are you going to measure? The second is, how do you create structures of accountability for the industries? And three, as I was saying earlier, instead of just scolding industry, how can we actually engage this corporate sector? How can we start to think about trying to not just compel them to change, but to get them to want to change? And lastly, importantly, we need to engage the consumer sector, because ultimately these are all creating consumer goods or necessary for the society that people seem to want to engage in. So how do we activate the consumer layer? Well, so one of the things that we did is at my nonprofit Building H is we decided to try to measure that first component, just what is the impact? And so we have been creating what we call the Building Age Index, where we rate and rank companies, and these are the companies in these 4 industries. We rate and rank their impact on human health. And we look at 5 behaviors. So we look at all of these behaviors are highly correlated with positive or negative health outcomes. And this is a framework we actually developed with a researcher at Stanford. And I wish it was Berkeley, but it was Stanford. And anyway, so 4 industries, 5 behaviors, and ultimately we come up with what we say is an H score, a health score. It's a 0 to 100 scale. And there are some companies that score very well. Cul-de-sac is a company developing walkable communities in Arizona and hopefully other places in the country. And so they're designed to be healthy communities. So they score very well. And Netflix, which has the autoplay and a whole other host of insidious product features that are invisible perhaps to our eye, they have negative impacts, not just on sleep, which Reed Hastings, the former CEO of Netflix, he said, what's your biggest, he was asked at an investor meeting once, what's your biggest competition? And he said, sleep, which was funny, but probably very telling for revealing for what he was thinking. So they go after sleep very effectively. The average American actually spends more than 7 hours a day on media, TV, streaming services, whatever. So a massive amount of our time is being sucked up by these services. So they score very poorly, as do other companies of their ilk, like Prime Video or Apple TV. All right, so but ultimately we're scoring each company on the kind of our subjective evaluation of how they impact those behaviors. So it's starting to create a quantification, but not necessarily a tally of the economic toll. And that's a harder problem. So if we actually want to start measuring the impact of these products and companies on human health, we need to start looking at diseases and the cost of disease. There's a lot of literature on how much society spends out of that $4 trillion on treating individual diseases. But to go back up to causes and start attributing it to specific companies or products there's nothing there. So we decided we would try to go there. This is very nascent and new work. It's an opportunity for lots of great new research. But we started with Burger King, or we're starting with Burger King, and just wanted to know, like, because everyone goes after McDonald's, but what about Burger King? What about the number 2? I should say McDonald's is more successful than ever. Like if you think about 20 years ago, there was Super Size Me and there was a kind of backlash against fast food. That is gone. Like McDonald's is one of the most successful, profitable companies in the world right now, in part because of those BTS combos and the Travis Scott meals and all this stuff that they do. They're incredibly effective. Burger King, not as big, not as strong, but still incredibly impactful on human health in this country and worldwide. So what is that impact though? What is the cost of going to Burger King as a society? So the questions we had were, what do we measure? How do we measure it? And then how do we engage regulators or the company or consumers? So I won't walk through every step of this, but we came up with a framework. People can hear me, right? Mm-hmm. Okay. Otherwise, this would have been very awkward 20 minutes. I've just got all these little alerts popping up. Okay. I'm going to spare you, but we came up with this framework that we're trying to break down this problem. And the easiest way to think about it is we're using this notion. I keep on looking at you because you're the epidemiologist, but oh, really? Oh, awesome. Yeah. So it's great. it's an existing piece of or methodology for well, I would say you're not on mic, but correct me if I'm wrong, and please correct me if I'm wrong. But it's an existing methodology for attributing the cost of or the consequence of no, I'm messing this up. It's how to attribute to a population that some whatever the input is, right? The
fraction linked to the exposure.
right. That's what I was at. The exposure. So usually it's the exposure of a right. Well, in this case, where our exposure is Burger King, right? So we're trying to take that methodology from epidemiology and bring it to commercial determinants. So what we and I don't have the final, you're probably all looking for what the final number is. I don't have the final number yet. It's in the billions of dollars. But basically, we looked at the estimates of how many calories are consumed by Americans eating Burger King. And then we look at the overall number of calories consumed in the United States, which those numbers exist. And you get about 0.4% of calories consumed in the United States are at Burger King, which seems like a tiny bit, but it's also a massive amount of calories. And then you can look at the relative risk for, say, you can look at the sodium score for their products, and then look at what that volume of sodium impact is on cardiovascular risk. And basically, you can come up with a pretty sound dollar amount of what is the actual impact on human health from Burger King. And as I say, it's something we're still running the numbers, and it's something like $6 billion, which is a lot considering its externalities, right? This is unaccounted for costs. That's what Burger King is costing society that they don't have to pay for or compensate society for. And ultimately, this should be done for every company, not just the 70 in our index, but every company that makes a consumer product that has in any tangible way an impact on human health. Food, certainly, but also entertainment, transportation. What we're trying to do is create a methodology, an econometric model where you can basically start to measure that. Okay. Now, what do you do with that number? So again, if we just have measured it, we're not changing. So there are other things we need to do. The concerns are, well, if we're working towards more regulation, the winds are not blowing towards more regulation for public health these days. So we have to think about other ways of creating accountability and action than this traditional route of regulation. There is what we think is promising is to use this to start to pressure investors, going first to social impact investors or ESG investors. Now, if you are ESG is facing its own political blowback these days, but there is still a community of investors and investing organizations or investment entities that do subscribe to ESG principles. So that's something we're working on. And then there's obviously B Corps and companies that might be designed to be more mindful of social impacts at the get-go. And we can certainly engage with those to create better versions of all of the above. But the concern there is that ultimately you're kind of preaching to the choir. You're not changing the systems. Burger King is not a B Corp. And if you don't know what B Corps are, you definitely should Google it. Okay, so those are the possible ways forward. Lots to think about there. This is really the last slide. I want to point to areas of possible direction and collaboration. So the first is to do the math. So we need to do more measurement and more quantification. I think it's really important to note that what the University of Chicago, the team that did that study on Netflix and autoplay and the negative effects of autoplay was a school of computer science, not a school of public health. And I would encourage people in the world of public health to reach out to colleagues in computer science departments, data science departments, design, because again, the better we understand how these products are built to work, the better we can take apart their UX. And that may involve collaborations with design departments, maybe places that have better funding these days than public health, frankly. That is a way we can quantify and begin to measure. And once you have the numbers, you can start to advance the argument. I encourage us to, secondly, measure the everyday, not just think about the so-called bad actors or the evil companies, but to really think about the context where people live their lives every day. And when you're able to quantify, say, the impact of McDonald's, that could get journalists interested. That could get people in the food development industry interested. So you can start to think about engaging these industries themselves and experts in these industries as collaborators because I know there are food developers who want to create better products, healthier products, products that are actually delicious and better for us. So let's help them get on a better path. Thirdly, it's important that we not just think about the bad actors, not just gun companies, but like the Netflix that we know basically aren't necessarily creating good companies or companies that are healthful for their users. But even Netflix can be better. If Netflix took that autoplay and made it you can opt out of autoplay. What if it was an opt-in to autoplay? What if there are, and we talk about minding the defaults. So all these companies all these products have default modes. And if we can get companies to make the healthful choice the default, that is a huge win. So it's important to engage the corporate sector and to engage every company that we can think of. And it's also important to think about these companies not solely as adversaries or enemies, but as, there are ultimately human people in these companies, and we need to make sure we are speaking their language such that they can improve their products. Because in the absence of regulation, if we're doing is scolding, we will never win. And finally, I do think we need to follow the money and think about where is the investment community and the consumer world as people who can be engaged. We can think about like what happened with cigarettes and turning smoking from a cool thing into a slightly stigmatized thing. We can think about how we're changing the way these companies and products are perceived. So that's that, and there's more to talk about there. But that's basically it. One of my heroes is a genius inventor of the 20th century called Buckminster Fuller. And he was onto this very early, that the best, and I'm sorry about his non-gender neutral language at the time, it was the 1950s. But I think he was onto something when he thought about how do we not just, again, scold people, tell people to do better, give them apps, but actually try to create better environments for them where they want to engage with a healthier way of life. So that's it.
Questions?
I can stop sharing. Please.
One question. I have a just imagination. See, I have come to this country recently.
Okay.
I come from India. I was a radiologist there and worked there for 30 years as a radiologist. Before that, I was a family physician. So obesity is of course a very important burning topic. And as you have also mentioned, emphasized, there are a lot of disorders which can be prevented out of this. And see the experience of a developed country. I have come from a developing country to developed country. And I always thought there may be something good about this country regarding obesity, but I found it's not there. And I visited Costco. I don't know, you must have.
Oh, I was just at Costco.
The price of ice cream was so cheap and the quantity was so big that I was amazed that our 3 family member could eat one serving. So I thought, why not to tell the Costco that start serving less, so that I think one of the factors, as you has mentioned, obesity can be, one of the corporate step can be in the form of that they can reduce the quantity. And, I think I was told that a lot of people eat there, and the caloric value I saw was like 1,000 calories for one dish they were serving. So I think that could be the very easy, and probably I think you have not mentioned that. Costco is a very glaring example of what I could see here.
Yeah, no, absolutely. I mean, so we've created these structures of abundance in our society, or apparent abundance, again, without actually factoring in the whole cost of that abundance. And I think it's very, and that's because people want the massive amount of ice cream, right? That brings people pleasure. It's hitting on our dopamine centers. There's all sorts of reasons why we crave ice cream. For my purposes, I am not going after like ice cream as a product, because it is a symptom, I think, of a larger structure where, for instance, when you're talking about dairy subsidies and all these other kind of things that make that ice cream so cheap, what I think we're trying to do is think about, okay, what kind of tax or penalty is society paying because that ice cream is so cheap? So I think you're exactly right. I think the other thing what you remind me of is there was a
Even I'm not talking about only a particular item.
yeah, no, I know.
I'm talking about burger, pizza. They are giving, in a huge big amount, like the calorie for one serving was 1,000 calories, and people were taking half the pizza. So that because I think Costco appears to me a very logical, company. Their products are quite healthy. So some of the products are very innovative, very healthy. The same way Trader Joe I saw is absolutely magical. They are trying to give a healthy product as far as possible, some of the products. So I think even somebody like at important level, one should suggest Costco that maybe you reduce this price to $1 or a $2 ice cream and reduce the quantity to half. And I think people will be satisfied with that. And the other thing is they will not be wasting. Because sometimes, you have to waste with this possibility. So that
No, I think you're right. And I think, we haven't, I think beginning to kind of include the Costco's and this is the supersize phenomenon, right? It's so starting to try to quantify what the impact of having massive serving sizes or product sizes is, I think is a really promising direction for it.
The other thing they noted here.
Let's have some other people.
Yeah, there's one more question online, if you.
Okay.
Sorry.
Sorry.
That's okay. Liza, one has a question about if you're interested in looking at mortality as an outcome. She said, it looks like in the part where you're calculating PAF, you're looking at the impact of these companies on causing chronic diseases, but what about straight up impacts on mortality, costs around life lost? I bet if you did that, car companies, gun companies, and possibly opioid producing pharmaceutical companies would show up as being hugely costly. Is this a direction you might go considering mortality?
Yeah, I think absolutely. I think we got a little bit of funding from the National Academy of Medicine to look at one company. So if we had more funding, we could expand it. I think mortality, one of the things we're like, when I had this, whatever the number is, $6 billion for Burger King, one of the concerns we had was, are they going to sue us? And because nobody has done this math before, this is really stuff that has not ever come out. So if we start saying that Burger King costs X number of lives, which is on some level true, right? You can quantify that on some, and I don't know if you can attribute mortality as a one-to-one, but you can start to get there. It does create some concerns of how far we can push that. But I think it's definitely something where, you know, more collectively, you can talk about the cost of junk food or fast food on mortality, and that would be plausible and measurable, I think.
And there's a question from Liam. Have you done any research on how different groups of people are impacted by these factors? I imagine marginalized groups such as Black Americans, people with disabilities, poor people, et cetera, are impacted at a much higher rate.
Yeah, absolutely. I mean, that's one of the reasons, that was one of the inspirations for the work, was because, you know, a lot of these services that we're talking about, especially food, for instance, but also when you're looking at kind of housing and access to transportation, access to getting outside, those are all easier in certain communities of wealth versus others. And so it's definitely a huge variable that we're mindful of. We haven't actually gone to that level of breaking it down by populations, but it's one of the things that inspires our work, definitely.
I was interested in how you're doing the calculation. So two questions. One is, you know, for a lot of the whatever risk ratio or rate ratio you're using in your measure, you know, there's different values of that from different studies. So are you incorporating like sort of any uncertainty or any bounds around the cost, or are you just like declaring a number, the correct one? That's one question. And then how are you dealing with, like, you know, Burger King is not only salty, it's fatty, it's, I'm sure, unfibrous, et cetera. Like, how are you considering its many?
Yeah.
features?
Well, I'm glad there's an epidemiologist in the room. So I'm not personally doing the analysis. We're working, we got a grant that we're working with a team of people who know what they're doing. I can come up with a methodology, or I can ask them for the methodology, and I can get that back to you.
Okay.
Those are both great questions. Like, I assume we're using a range rather than just choosing one number. But yeah, and I think, and we are going to more than just salt. I mean, there's obviously fat and other issues.
Yeah.
But I think again, what we're trying to prove is just that these things can be measured, and that you can start to put some numbers on them. But I would love for you in particular to see some of that.
That would be a great, actually, teaching example, because when you get to measures like population attributable fraction, students are often like, when would I ever use this? And
Yeah.
this would be, this is when you could use this. It would be nice to have that.
Yeah. One of the things that I learned, actually not from me, but from a friend who went to the School of Public Policy here at Berkeley, was he talked about there being a kind of, and this was the 1990s, he talked about there being a poor tax we lived in Oakland at the time, and it was when a lot of people were installing bars on their windows because of crime. And that happens more in poor neighborhoods or it was happening then, more people in poor neighborhoods were installing bars on their windows than in wealthy neighborhoods. And he was talking about it as a tax that poor people paid. And that has stuck with me for decades. And I think that happens in health a lot, that certain populations and as a society, we pay taxes on these things that we don't really think of or are watching. And I feel like a lot of these things, like so people eat Burger King because it's fast, cheap, and convenient, and they like it the way it tastes. Even though probably in some way they know it's bad for them. But if we can start to and we've tried, right, with quality or with calorie mandates to put calorie amounts on and nutrition information, stuff like that. But when you're actually able to better help quantify what that downside is, I think that's painting a different narrative that hopefully will allow individuals, but also society, to move in different directions. Oh, sorry.
Oh, yeah, he answered Liam's question. Yeah. It was Liam's question I raised.
Oh, you already.
Yeah.
Oh, it's thank you.
Yeah. Thank you. All All right, well, thank you everyone for joining, and thank you very much to Thomas for sharing your work with us.
Yeah, no, it was a
And,
pleasure.
Yeah, forward to hearing more about what develops. So, all right, thank you, everybody. Have a good day. Bye-bye.